We have a group that started in the spring.
Oh, I see.
And of course, we have a group that started in the summer.
Uh-huh.
So, I think most of these students probably know John. But he talked with us and said, my grandmother would love to come and talk with you about living with rheumatoid arthritis. It's like, wow. And I had just talked with her on the phone briefly a couple weeks ago. I had watched someone like an energetic person that has so much to share. So I'm glad that I can sit in this session and do another one on super.
Thank you, Jeanette. Thank you, students, for coming. My name is Jan Cochran. I'm 73 years old. I have had rheumatoid arthritis for almost 50 years. When I was first diagnosed, I had 4 young children. I had a son and 3 daughters. With each of my daughters, I hemorrhaged. The last daughter, when I hemorrhaged, it wouldn't stop, and they took me to the hospital. I had a DNC. During the DNC, I got a fever of 105.5. They thought I had meningitis. I had puerperal fever, which is what they had in the covered wagon days, or blood poisoning of the uterus. I was in the hospital for a week with blood transfusions and very heavy-duty antibiotics, and I was a very sick person. 6 months after that, I became symptomatic with sore feet and hands. And it was really strange because the first thing I noticed is if I walked on sand, the balls of my feet hurt. And they hurt like, what's the matter with my feet? I cannot understand why the balls of my feet would hurt. It just didn't make any sense. In those days, like I said, I had 3 daughters, and there's no polyester in that time. You ironed everything. So once a week, I would iron for 3 hours. After ironing for 3 hours, the balls of my feet and my hands would ache like a toothache. Just like a toothache. And of course, what do you take in those days? You pop an aspirin, because that was all there was. This went on for a long time. I became symptomatic and I went to my doctor. He couldn't figure out what was wrong. He sent me to an orthopod. He couldn't figure out what was wrong, and he put me in University Hospital, and that's what they called OHSU in those days. And I was there for almost 4 weeks under observation. 6 doctors surrounded my bed one day and said, Mrs. Cochran, or actually I was Mrs. Freeland at the time, you have rheumatoid arthritis. And what do you think of that? And I said, well, I know what it is. My mother's grandmother had full-blown rheumatoid arthritis. She raised a large amount of children on crutches. She milked cows on crutches. She was a very strong lady. My father's mother had what she used to call rheumatism. Well, we know now she had a form of arthritis in her knees. She used to rub her knees with horse liniment every night before she went to bed and wrap them in an ace bandage. But this woman persevered at a farm. And I mean, she took care of her garden, she canned, she cooked, she did everything. So my mind went to that really quickly. Like, if I have it, and they did this, and my other grandmother did this, I can do this too. So I said to the doctor, what are you going to do for me? To help me take care of my children? Because at that point, there were times when my body was so in pain. I can tell you one time my other grandmother came up and stayed with me for 3 days because I was on the couch and I couldn't be touched. It was like my whole body was on fire, and I had a sheet on me, and she wanted to put a blanket. She thought I'd be cold, and I said, please, no blanket. I can't stand the pain. I would have to barely make it off the couch to pee in a coffee can because I couldn't make it to the bathroom. The pain was horrendous. But what's funny about a disease like arthritis, you have it 1 minute, and 24 hours later, it's gone. You don't know how it came, and you don't know where it went. One of the doctors that surrounded my bed with negativity said, well, I said, is this going to kill me? And he says, well, you won't have a very long lifespan. He said, usually around 50, when you're around 50. And I said, how can you say that to me? That is ironic that you could make a statement like that. You could get hit by a train walking out of this hospital. I mean, that's such a negative thing to say. I can't even believe you said it. Well, anyway, they sent me home to bed, and I was in bed for 10 months. Now, you understand I had 4 children, newly divorced, and they put me to bed. How do you do that? And my rheumatologist said, Janice, he said, I want you to lie in that bed, and if you look at your window and it's dirty, I want you to say, so what? It's dirty. If it bothers you, you go get a bucket, get a rag, and wash it. Because you're such a type A personality that you're as bad off worrying about it as doing it. He said, and I said, well, what do you think I'll be like when I'm free of this disease? He said, if your house is burning and you go to the store and get hot dogs and you sit on the lawn and roast a hot dog in your burning house, that's the day you'll be through with arthritis. He says, but the chance of that is pretty slim. I had a lady that came to the house from 6 in the morning to 6 in the evening and helped me with my children. My mom and dad, my ex-husband took over on the weekends. And, you know, I was thinking the other day, I want to tell you about my surgeries, because for these little people to see mom in casts and braces, this is just a few of the apparatuses that I've always had. You can imagine, okay, in 1972 I had a gallbladder surgery, which had nothing to do with my arthritis. But after that, I had a synovectomy in the right elbow, okay? I had a hysterectomy, which, and a cyst, a huge cyst on my ovary. Then I had my right MTPs removed on my right foot. During that, after the surgery, I was in a cast. I had a pin sticking out of my toe, and you can imagine how my children felt. My son was embarrassed. Every time I had an apparatus on of any kind of big bandage on my head, he was mortified. It was like, that's not my mother. I don't want my mother to have all this. It just scared him half to death. He thought he would get it himself. I think my girls took it more in their stride than he did. Okay, then I had a synovectomy in my wrist, my left wrist. I had a triple arthrodesis in my left ankle. That's where the side-to-side movement is restricted, and that went really, really well till finally the ankle really hurt again. And when I say hurt, I mean, if I was in bed and had to go to the bathroom, I would stand by my bed till the waves of pain went over me, till I could stand it to walk to that toilet to go to the bathroom. The pain was horrific. You just can't even imagine, unless you've been there, how badly it hurts. And like I said, my children saw me through these things, but all the time with my braces, my leg braces, my wrist braces, I was cooking, cleaning, doing, living, taking care of my children, helping my mom and dad. I'm an only child. I think the power of positive thinking, you know, you kids, I can't call you kids, but I'm so old I can. I feel like you're kids. You young people, you have to have days when you're going to school and you're tired and you're sick of books and one more place to be, and you say to yourself, I don't know if I can do this. Well, you know, that's kind of like being a patient. Because we have days like that too, where we go, I don't know if I can do this. But I always say, you can do it. I don't care if you put a note on your bathroom mirror, right, I can do it. I don't care what it is, you can do it. If you tell yourself you can, it may be different than other people do it, but you can still do it. Just like one of the students was asking me why I told her I had to use my teeth to make my bed, because this wrist was so tender, I couldn't even touch it on anything. And she said, well, why do you make your bed? Because that's who I am. I'm not going to lose who I am by having this disease. This disease better come after me, because I'm going to keep going and be me. Do you see what I'm saying? So that power of positive thinking, that energy that says, I'm going to cook this big dinner tonight, and it's going to take me a while, but I'm going to do it. You do it. My husband made me a board with a nail on it, and in the nail, I could put head of lettuce, I could put celery, I could put whatever, and cut it with my left hand. So when you come up and examine me, and after a while I will tell you how, I want you to feel me squeezing your hands, 2 fingers on each hand. This is my strong hand. This hand is very weak. This is my prosthetics in this wrist. So you can imagine what it's like when you change hands. I'm right-handed, but I still write with this hand, but this is my strong hand. People have asked me, why don't you have that fixed so it looks better? Well, you understand, every time you have surgery, you lose a little strength. And when you have arthritis, God help you, you don't want to lose strength. So get a grip. It's my problem, and it doesn't bother me at all. Okay, let's go to the next surgery. I had a left wrist clean-out surgery, and that's this wrist, as you can see. And what happened is all the skin sloughed off, and when they took the cast off, it was purple slime, is all I can say, and no skin whatsoever. So he said, well, go home and get salt water and soak it in saltwater baths about 5 times a day. I did, healed perfectly, no problem whatsoever. I love someone in the medical profession that makes light, says we can fix this, and if I can't fix it, I will send you to someone else that will. All my life as a patient, it's the nurse, and never forget this, you are the liaison between the patient and the doctor. You are the one that when you smile and I walk in that exam room, or you come in my hospital room with a smile on your face, you light up my day. You make me feel like, okay, it's going to be okay. Now, those doctors pop in for 10, 15 minutes. Isn't that correct? And they can't possibly ask all the questions. But you can. And you know what you need to talk about is sex. I was 26 years old and I thought, oh my God, racked with pain like this, how will I ever have sex again? Well, let me tell you, you will. And guess what? A good orgasm, Friday night, Saturday morning, your arthritis feels like a million. So don't forget it. But we are sexual human beings from the time we're young. And don't forget that that is part of our life. So no matter what age we have arthritis, it's still... One of the ladies that I teach was a graphic designer, and she's in her 60s now, and she says, my husband and I we have a good sex life, but she says it's called geezer sex, whichever way the joints work that night, or what is hurting, depending on which way we have it. Okay, what is my next surgery? Okay, I had my left wrist clean out, then I had a polyp in my throat, which was a nodule. When you have rheumatoid arthritis, usually you will get nodules. I want you to look at my nodule on my elbow, and I want you to palpate it. It is a subcutaneous cluster of fibrous tissue. It moves, and it does not hurt at all. They removed one from my throat, and then they removed one from my ear. The tentacles were out so far that the surgeon removed 1/5 of my ear, mind you. So I have this apparatus around my head at my son-in-law's birthday, and it abhorred my son. Absolutely, how could you go out of the house like that? Well, it's the way it is. You have to face life. And he can't face life like the girls can, my girls can. Okay? Let's see. Then I had a left elbow clean out and a fusion of this finger. The irony of this is when they did the clean out, my arm looked like Popeye. You know what Popeye's fat lower arm looks like? Well, that's the way mine looked. So the surgeon went in there, when you see the scar, where the scar is, cleaned it out, and also he fused this finger. This finger was so bad that I couldn't do anything with it. It was so curved. So he fused it, there was a pin in it, and I had that pin in there for a long time. Well, one day I went to the beach to see my mom and dad, and in the middle of the night it starts aching, and it's aching, and it's aching, and I called his office, and that means it's moving to come out. So I have heard of concentric magnets. One of the gals that works at the salon where I get my hair done sells them. So I thought, why can't I try a magnet on my finger? And he said, he didn't want to mess with it again because it probably would not fuse again. So I cut a magnet in half, put half on the top, half on the bottom, and I taped it and left it there for almost 2 months. I never touched it. And look at my fingers fused. Is that just weird or what? I mean, it's ironic, isn't it? It worked. Whatever works, I think, is wonderful. Okay. I had a second wrist clean out with my, like I said, with my left wrist. My right wrist, I mean, this is a prosthesis. This prosthesis has been, they said it would be guaranteed for 5 years. And I've had it since, what was the date on that? It's a long time. But, what was it? Yes, I think so. They thought I had an extensor tendon rupture, so the surgeon opened me up, went in, and it was adhesions across my tendons. So he cleaned all those, so I lost my pinch. So when I sew now, I sew with these 2 fingers. And I thought, can I sew with these 2 fingers? Well, sure. They touch, so that means I can hold on to the needle, right? So I sew with these 2 fingers. That's the price. Whatever. It's like you make the best of what it is, whatever it is. Let's see. Okay. I had a vaginal sling put in. I had 4 babies, and a lot of times when you have 4 babies, you have a hard time with your bladder. Like if I jumped on a trampoline, oh my goodness, never could hold it, right? Well, then the problem didn't present itself for years, and then it got worse. So I had a vaginal sling put in, which is still working great, and it's a great surgery. And then, it'll be 4 years this Christmas, I have this magnificent ankle. So now I have 2 ankles. I have a fusion on this side that was done years ago, and this is a more recent one. And let me tell you, they are my nirvana. No pain, 0, none. Can you imagine what it's like that I would have my brace in the bathroom, getting up at night to go to the bathroom and crying all the way to the bathroom? That's the way when you have ankle pain. It is horrible, horribly debilitating. But they made this wonderful brace, and I want to show you this because my girlfriend, she had cancer, and she was my best friend since the 6th grade. And my ankle was so bad, and I said to the doctor, you have to get me some help. I want to go help her, okay? So he had this boot shop, this orthopedic place, make up this boot. Now, does that look like a motorcycle boot except it doesn't have a toe? Well, guess what? I said, I don't want the toe because it's going to be hot, and I hate hot. So leave it open, and he said, but you'll freeze your toes off in the winter. I said, no, I can always add something. I can't take it away. So I put this motorcycle boot on and drove to her home hours away. The first day I put it on, do you know what? Not a stitch of pain with that on. None. How they do it, I don't know, but God bless them. And I wore that for 3.5 years. And it was, every time I had it on, no pain. But pretty soon you get to the point that they want to do the surgery. And so then I had the fusion done. When you have arthritis, you need to be proactive. You need to rest. Fatigue is a big factor. Usually people will notice it at the beginning. Some people have it all the time. And when I say tired, I mean really tired. But I can power nap better than anybody. My father was the best power napper in the world, and I can do the same thing. I can have a 15-minute nap and be rejuvenated, but I always take my afternoon nap. From the time I had the first fusion, the surgeon said, I want this foot above your heart. Well, how do you get your foot above your heart? Unless you're laying flat in bed and you've got some kind of a crate or something. So if you lie on the couch, the best thing, put your leg up on the back of the couch. Piece of cake. So that's what I did every single day. And that's what I've done with this other surgery. And I still take a nap and sit on the couch every single afternoon. I go through what they call relaxation therapy, meaning you start at your feet, you tense every muscle and relax it all the way up your body, every single muscle. And let me tell you, by the time I get through with my muscles. I'm sleeping like a baby, and I have my nap, and I feel wonderful. So I figure, okay, now I can go on and do my next whatever it is that I'm going to do. A year ago, this last August, I lost my daughter. She was life-flighted to OHSU with leukemia. She had had an aneurysm in 1996, but she made it. She had a clip put in, and I mean, there were no after effects. She did wonderfully. Well, she told me that she was very, very tired, and she was having horrific headaches. So I got her an appointment to a neurosurgeon in Bend, who, God bless his soul, did an MRI the minute she walked in the office, and came out perfect. She called me and said, "Mom, it's perfect." I had a glass of wine. She had a glass of wine in Bend. We were both elated. He said, "I'm going to give you some blood tests. I just have a gut feeling." And he gave her some blood tests, and when the results came back, he said he was going to call her on his cell phone. So he called her at home and said, "Pam, you have leukemia." And I mean, what is that? What is the open door to leukemia? You don't have a clue. So she calls me and said, "Mom, I have leukemia." And I'm like, what does that mean? I mean, cancer is like chemo, you know, treatments, whatever, but what is the door to leukemia? So my husband and I took off for Bend. Well, to make a long story short, by that evening she was in the Bend hospital. She was life-flighted the next morning to OHSU, where they started treatments immediately. And the reason I'm bringing her up in this story is the doctor said she needs to stay in the Portland area, not more than 20 miles from the hospital. I'm 15 minutes away for over a year. And I said, great, she can come back home. I mean, piece of cake. So anyway, that's what happened. I mean, she would be in the hospital a week. She'd come home every day. We'd go to the melanoma pavilion for the infusions. Came home, I mean, the sick and the 8 million pills. And I kept, it's really funny because I kept saying to my body, okay, Janice, come on, God, I need some help here because this is going to really not just try my emotions, because this is my child. It's going to try me physically. So I thought to myself, how am I going to do this? And I can be very regimented if I have to, and that's what I did. And I thought, I knew I had to have rest, so while she napped, I would lie down for an hour. At night, if she was sleeping well, not sick, her daughters she had 20-year-old daughters, they would come in to stay for 3 or 4 days. Her husband would be there once in a while. And it was like this, I call it the nightmare of leukemia, but I wanted my body to stay strong. I have no time to cave in now. I have no time for findings that are hurting and I can't do something. I needed to, my husband drove us to the hospital because my shoulders are so bad that if I drove to the parking structures, I would have died with my shoulders. And so he would drive us up there, go back home, come back and pick us up, and this went on for 14 months. So my body did it. I could do it. Do you understand? I could do it. But she passed away the 2nd of August, and her memorial was in September. 3 weeks later, I was in emergency. This shoulder was, well, they thought it was my heart, and as it turned out, I had horrendous, horrific pain. Horrific pain. I mean, I can't even tell you, out of my head pain. I wouldn't even wait for the ambulance. I mean, I was gritty, I was beyond it by the time I got there. And they did heart tests because the pain went from my arm, through my chest, back to my scapula. And it was so horrible. The only thought of a relief was pressing on my scapula against something. Okay, they put me on pain medicine, did all the heart tests. Anyway, it wasn't heart. 2 weeks later, I'm back at emergency, and they did an MRI of my shoulder, and my shoulder is destroyed. Basically, what he said was, you know, you have a golf ball on a golf tee. Well, you don't. So, but the inflammation, I had every type of inflammation that you can think of. I had synovitis, I had bicipital tendonitis, and subacromial bursitis. I mean, I was a mess. And after that, it was like I knew my body was reacting probably whatever from a whole year or 14 months. So I was supposed to have surgery and had my shoulder fused. This was the first part of the year. And my family doctor called me and he said, Jan, he said, I really don't want you to have the surgery. And I said, why? He said, because when I'm ready for surgery, I'm ready. Okay, now surgery's tomorrow. Everything's done. Bills are paid. You know how that goes. I'm like the horse at the track, you know, that's ready for the bell to ring. And he said, because you have been emotionally exhausted and you don't even realize it. And I said, but I feel fine. He says, it's not that you won't make it through the surgery. He said, it's a recovery. Your recovery it's going to be really hard for you. And he said, I want you to cancel it. Well, I waited the whole week. I thought, no, I'm not going to cancel it. That's ridiculous. Because I always truck forward, you know. And one day I thought, maybe he's right. And I canceled it. And the funniest thing happened to me, which I've never believed, I admitted to myself that the weight was lifted off my shoulder. It was like I've been climbing all these mountains, and now there's another mountain. And man, he took that mountain away. And it made me like take a deep breath and relax for the first time in a long time. So I haven't had the surgery, and as you can see, I can't do a lot with this shoulder. I have to be very, very careful, but at least I can function, which is really, really important. Jeanette has a list of my medications. I'm on a lot of medications.
I have a question.
Sure. When I went to bed and got out of bed, my doctor went on sabbatical. So I had a new doctor, and he says, okay, you can get out of bed now. You can imagine I'd been in bed for 10 months. I'd been on physical therapy. The Red Cross picked me up twice a week, and I went to OHSU for physical therapy twice a week. So he says, you can get up, and I'm going, huh? Just like that? Well, I knew I had to have a job, and I had no skills. I mean, I got married at 16. So anyway, I registered at Portland Community College, and I went to college. And in those days, which women are smart now, everybody wore high heels. You know, you wore dresses and heels because that's the way you worked. If it was go to business, you wore dresses and heels. So 6 weeks into the Portland Community, one of the instructors said, Jan, would you consider going on a job interview? And I said, okay, when? And she said, now. I said, you're not serious. And she says, yes, right now. You're dressed, you look fine, just go, see what happens. I said, okay. I'd never been on a job interview in my entire life. The only thing I had going for me was I typed 85 words a minute. I had never taken a business machine. I wanted to be a nurse. I took every nursing class in high school, loved it. So here I am with my 85 words a minute. I was just learning how to use a adding machine at Portland Community. I was interviewed and given the job. Well, I was typing for 118 designing engineers of pulp and paper mills all over the world. So the volume of typing was amazing, right? So that means you're sitting in one spot typing. At the end of the day, I would wait for all the engineers to leave because when I'd stand up, the balls of my feet would be so swollen and so sore that I would cry to the elevator and cry all the way to the parking lot to get in my car. Okay, and then I'd get in the car and I'd have to sit there just till the waves of pain got better. Then I'd drive home. Well, when you get home again from sitting for 20 minutes, 30 minutes, then you got to do it all over again. So in those days, when I get home, we had a laundry room in the basement. And also I had all my canned goods and everything in the basement. So I had 4 children to cook for, right? Well, how about going down those stairs? And if you say to one of your children, could you please get the green beans? Could you? Then they are running back and forth and forget. And so you think to yourself, okay, I can do this. So you go down all 12 stairs, like one, and count them. I used to get, so I counted everything because I could handle it if I knew how many steps I had to take, see? So it went on like that for years. I can remember grocery shopping and going up the stairs and, you know, paper bags with handles. And here I am going up the stairs. My foot hurts. My hand hurts. I got so shall I make 2 trips or 1? And I thought, I sling my purse over my shoulder. I pick up the bags. I am going up the stairs, and both sets of handles broke. And I said, that's God telling you that you're just trying to do too much. So that meant I had to pick it all up, right? And I had to take a lot of time to do it. But things like that happen when you have a chronic illness. My father had rheumatoid arthritis also. He had symptoms in his hands when he was 55. By the time he was 70, he had double knee transplants. And he did great. He went fishing. He didn't let his arthritis stop him at all. He was a very strong man. He passed away in 1996, and I was with my mom at Coast and helping her get all her paperwork and everything, and I had to come home. And when I was coming home, I was talking to God, and I said, you know what, God? My dad's nurse at his rheumatologist's office was a godsend. He would have jumped in a well for her, let me tell you, because she was so empathetic, she was so sweet, smiled at him and made him feel like a champion every single time. And I thought, I just want to give something back for all the wonderful people that have taken care of my dad. So a few weeks after getting back, I got a phone call from my rheumatologist's office, and he said, would you like to go on a meeting at Providence Hospital? I'd really like you to go and check it out. And I said, what's the meeting about? And he said, well, it's about arthritis. I said, oh, okay. So I went. And there were probably 25 people there, and the teachers were there from University of Texas, UT Southwest Medical Center. And we saw this movie, and it's like they showed us the musculoskeletal exam and who gave the exam was patients with arthritis. Well, what they wanted us to do is teach patients at OHSU the musculoskeletal exam using our bodies so they could see our findings and feel what that felt like, okay? And I thought, oh my gosh. And as it turned out, there were 12 of us at the beginning. There's 3 of us left. And we were teaching the second-year medical students till we lost our grant from Pfizer because they said medical education is not necessary. But we still do the PA students in Pacific University. And I mean, we have had more fun. We did the nurse practitioners at OHSU. And it has been just a fun program. And if I can help give anything back, if someone can learn, a doctor, a nurse, anything, how to treat and handle patients with arthritis, then to me I'd be giving things back. So, and if you have any questions while I'm talking, please feel free to ask me any questions. Should we go over my med list? How's that sound? Okay, my Remicade is Nirvana medicine. I mean, it's a biologic. The first biologic I used was Enbrel. I was telling Jeanette that I came from teaching in Arizona, and my knees were so swollen, the stewardess had to help me off the plane. I couldn't get out of my seat to go to the bathroom. The pain was horrendous. They were swollen. I had never had knee problems before. When I got back to Portland, my rheumatologist told me to come in. He gave me a prescription for the Enbrel. He said, I want you to go home and give yourself a shot. I said, okay. Because, you know, it was new. It was very new, and a lot of people, well, I'm not taking that. It's too risky, da-da-da-da-da. So, and I really had all the faith in him in the world. I went home and gave myself a shot the next morning in the stomach. It's subcutaneous. In 24 hours, I was sitting on the toilet, literally bounced up off the toilet and went, oh my God, I don't hurt at all. My knees didn't hurt at all. I don't know. So I called my rheumatologist's office and said to his nurse, it's Nirvana. It's a miracle. And she was wonderful. She was so enthusiastic, and I'm telling you, I've been euphoric ever since. You just don't know what it's like if something hurts every second and then it's gone. It's fantastic. Okay, I take salicylate, 1,500 milligrams twice a day. I take the Embro, it's an infusion that I take every 8 weeks. I take 1,500 milligrams of salicylate. I take it after breakfast and after dinner. When I was released from the hospital, they put me on aspirin. I was 25 aspirin a day for 10 years. After that, I went on gold injections, and gold worked pretty well for me. I was on them almost 20 years. And then, of course, I started Embro and then the Remicade. I always take my medication with food. Methotrexate, 10 milligrams once a week. And now you can't have Remicade unless you're on methotrexate. I take Toprol XL. One day I was doing the dishes and I fainted in the dishwasher. And it was very strange. When I got up, I called my doctor's office and he had me come in for a stress test the next day. And during the stress test, my heart was irregular when I was at the top speed in the stress test. So he put me on Toprol XL. And I've been on that 50 milligrams ever since, and I've been doing great. I also take hydrodiurel, they call it. It's a diuretic. I take that once a day. I'm on folic acid, 1 milligram a day. I'm on Salogen. I have 2 other diseases. I have a Sjogren's syndrome, which is dry eyes, dry mouth, and I also have macular degeneration. Now, the macular degeneration just started a few years ago, but the Sjogren's, I've had it for quite a while. I have done really well with it. They cauterized my tear ducts after having it for a year, and my bottom tear ducts, and actually that worked quite well. It flooded my eyes with tears, which was great, but then one of them came loose, and I'm on Salogen tablets now. I take half a tab morning and evening. Works great. I take Reclast for my bones. Now, I was on the Reclast program where I took Reclast. It's an IV. You do it once a year for 3 years, and then you don't do it for 2 years, and then they test you and see where you are, and it really did a tremendous amount of good to my bone density. Okay. Okay, Astelin. I had rhinitis, is what they call it, like an allergy. And the only reason I went to the ear, nose, and throat is because I lost my voice, and it lasted for almost 2 weeks. And my voice was so hoarse that my doctor was concerned. So he sent me to him and put me on this Astelin, and wow, it is a great medicine. Works tremendously. Let's see. Oh, I did Reclast. I take Estrace. I insert it vaginally 3 times a week, and it's a form of estrogen, but I really don't know how to explain it to you. It's the kind that your body makes. That's the closest I can give you. Sorry about that one. And every time I have surgery or go to the dentist, I have to take 2,000 milligrams of amoxicillin. Because I have prosthesis, my body could reject my prosthetics. My dentist had a lady that had a new knee, and she didn't mention to him that she had a new knee, and of course he didn't know to give her the amoxicillin. Her doctor had not mentioned it to her. Well, you have to have 2,000 milligrams an hour before you go to the dentist. and she lost her knee, and she had to have a new knee put in. The over-the-counter medicine I take is Tylenol, which is 500 milligrams. Not very often, but I do take it. I take an 81 baby aspirin every day. I've used Debrox drops in my ears every couple of months. I take Genteel, and I drop those in my eyes every night at bedtime. It's very restful. You guys could use it. It's over the counter. If you ever have dry eyes, go to Bend and go skiing and your eyes are sore, buy Genteel. It's wonderful. I also use Refresh Plus during the day, and I'll show you things here that when I first got on Refresh Plus, they're little vials. Well, I went to 3 pharmacies and I said, look at my hands now. How am I going to do this? How am I going to pinch a vial? Well, we don't know. And I said, you don't know. You mean not one human being the whole time you sold medicine has ever asked, how do you do this? So I went to Sears and I got these little pliers. They have a little flange in them. And you put the vial in there, and I put my eye drops in. Now, is that great or what? So where there's a will, there's a way. Because people with chronic illness want to be able to do it themselves. That is important. I take AREDS, A-R-E-D-S. Macular degeneration means that you can keep part of your peripheral vision, but the straight ahead vision, and you lose people's faces. Now, I can see your faces here because there's a lot of light coming in here, but it's so funny when it started. I have navy blue carpeting, so if I'm folding a load of clothes and a black sock falls on the floor, I can't see the sock. I mean, I literally can't see the sock. So if somebody would say, Jan, you dropped a sock, I'd say, where is it? Because I can't see it. I was chopping onions on a paper plate. I can't see a white onion on a paper plate. It's impossible. So I have to feel it to chop it. Do you understand? Because it has to be contrast. Everything around me has to be contrast for me to recognize it. And it's so funny. And I'm telling you right now that I have 3 chronic illnesses now, right? You have to have humor. You have to have humor. You have to have a nurse that when you walk in the aisle, I love my eye doctor's nurse, Andrea. I think she makes me feel wonderful when I walk in the door. She got a smile on her face. You know, my granddaughter went to work for the first time. She just graduated about 2 weeks ago. It was her first job. And I said, I want you to think about when you go to work, when you walk in Nordstrom's. And I use Nordstrom's as an example. I don't care. I can shop at TJ Maxx. I can shop anywhere. But those girls are told, period, you smile at everybody that walks in that door. I don't care if your husband beats you and runs off with a neighbor girl. I want a smile on your face. And that friendly atmosphere. And that's exactly what I told my granddaughter. I don't care if you're having your period and you're having cramps. I don't care if your boyfriend didn't call and now you're worried where he is. I don't care if you didn't want to get up and you're tired. You go over there and you smile. And when those moms see you smiling at their little kids, they're going to go, why, that girl, is she a sweetheart or what? Because that's what patients love. They love that warm, caring that a nurse can do, and I'm sorry, not many doctors do. It's just the way it is. So you can confide in your nurse where sometimes you'll never say the same thing to a doctor. Never. Just like my mother and father-in-law. My father-in-law was on 11 pills. So I happened to be over there one day and he had a counter and he had 11 pills. And he's taking his pills like this, just taking them. And I said, Fritz, what are you doing? And he said, well, I'm taking my pills. And I said, well, what are the directions? I mean, do these have to be taken before you eat, after you eat, with water? I mean, hour before a meal? I mean, what? I don't know. This is the way I take them. And so my mother-in-law is going like this. Don't talk because he gets mad. And I'm going, okay. So anyway, I called his doctor's nurse. And I told her this little story about Fritz, and she was a doll. She, of course, told the doctor all about it, told him the whole story, and called Fritz in. And I'll tell you, she took care of the problem. He was even taking his diabetic medicine wrong. I mean, and the thing is, you're going to find is women listen and men don't. God bless you guys, but men walk into a doctor's office, and if I say to my husband, "What do you say?" "Oh, nothing." He says, "I'm fine," and walks out, and I'm going, "Oh, okay, whatever." So remember, as nurses, talk. Okay, I was on Gold. My doctor, my rheumatologist, retired. I got a new doctor at OHSU. I think he was from Australia or somewhere. Okay, and do you ever have a funny vibe? Something, a gut feeling about something? I had a bad feeling. I was going to go in for my goal shot. The next morning I was flying to teach at UCLA. I went in there, and the nurse, he's just a great guy. Okay, the doctor comes in, introduces himself, talks to me for a few minutes, and he said, "Okay, give her the shot." Well, the nurse went to get the shot, and he brings it back, and he looks at this vial, and he says, see, gold is the color of light urine. This was brown. So he calls the doctor back into the room and says, "This medicine is the wrong color." Well, the doctor said, "Well, let me see the date." Well, he looked at the date, and the date was fine. Okay, so the nurse was not happy at all. And he says, "Give her the injection." So the doctor left the room, and the nurse gave me the injection against his own better judgment. I mean, what could he do? He had been fired. So anyway, he gave me the shot, and I pulled my pants back up, because you got your gold shots in your butt, in the upper part of your rear end. And I had to walk across a ramp into the next building, get in the elevator, go down to where I parked my car, and by then, I was going, "Boy, my face feels funny." And I thought, all of a sudden, boy, I'm really tired. Now, goal shots, usually I have a good hour nap after my goal shots. I don't know why, that's how it affects me. So I get in the car, and I had a hard time getting the key in. So I finally opened the door, get in my car, and I thought, well, I'm going to set the seat back and maybe rest here a minute. Well, I could feel then something was happening, like my legs. I was feeling this heavy around my groin, and I thought, I got to get back to this doctor. So I got out of my car, made it to the elevator, and there was a Hispanic family in the elevator, and I said, help me. And by then my tongue was getting funny. Well, they couldn't understand me, God bless them. So anyway, I went up to the third floor, because you have to go to the third floor to cross the ramp. And at the end of the third floor right there is a information lady. Well, by the time I got to her, my legs were huge. My pants were so tight, it was incredible. So I'm standing there going, help me. She says, I can't leave my position. And I knew at that moment, if someone else found me, they wouldn't know where I'd been to have my goal shot. So I knew I had to get back to that doctor. I had to. So I walked to the across the ramp, got in the other elevator, and I remember pushing 7, and I stood there and thought, don't faint. You can do this. And when it got there and the door opened, there was his nurse. It just was fate, and she took one look at me and went, get the doctor, and I mean, it was anaphylactic shock. Yeah, and I just about didn't make it. So if you have a gut feeling, use your gut. Use your gut. I'm not saying defy people, but I'm saying, he apologized for it, but it wasn't his fault at all. At all. So I and they wanted to put me in the hospital, but there were no beds. So they put me in emergency right next to the nursing station, and I stayed there till about 3 in the morning. Well, I canceled my flight, obviously, and about 11 o'clock, I said to myself, I think I can make this. So I called them back and said, see if you can get me on a plane later today. So they did. So they got me on a plane that afternoon, and I flew to California. So, I mean, like I said, you can do it. Put a sign on your bathroom mirror. I can do this. I can do this. I mean, just like that Nike sign, just do it. I plastered that all over my house. My kids have more sayings that I have given them that, and my grandchildren, that you just can't even imagine. You know, an ounce of prevention is worth a pound of cure and whatever, and I use them all. I think it's important that you use them all. Like I said, I teach the musculoskeletal exam, and I know you don't need to learn that, but I think it'd be interesting for you to see what a normal person does and see how limited I am. So if I could have someone come up front, not real tall, I don't care anybody. Okay. You're hurting your foot?
No, I said beans are.
Okay.
Perfect.
Okay, well, when you think about a shoulder, right, what we're going to do is we're going to do range of motion. You don't have to pretend like, do all the rest of it. We usually do inspection, palpation, range of motion, and the function. And the reason that we do that is because if we're going to inspect, if we palpated first, and without inspecting, we don't know if the palpation would cause the joint to be red or pink, or is from the palpation or from inflammation. Okay? So when we do range of motion, and you always hold a patient between the joints, never on a joint. Think of arthritis. Now think of psoriatic arthritis. I have rheumatoid. Psoriatic arthritis is soft tissue around the bursas, everywhere. I have one of our ladies that teaches, it was an ex-transplant nurse, and she has bursas, at least 7 every minute that hurt her, that she is in horrific pain. Okay, when we do extension, and I won't be able to lift your whole arm, so you're going to have to do this. Go clear up the ceiling. That's flexion. That's 180 degrees. Okay, now bring it down. We're going to, with your elbow at 90 degrees, right next to you, there we go. You're going to go back for extension, 30 to 60 degrees. Then you're going to go internal rotation is 75 to 85 degrees, and external rotation is 75 to 85 degrees. Now I want you to do that on me. So what you're going to do is hold between the joints. Mm-hmm. Okay, now we're going to go up to my point of resistance. That is it.
That's it?
That's it. Okay, now with my elbow at 90 degrees.
We're going to go back.
Extension. That's not too bad.
No, that's pretty good.
Okay, then we're going to go internal rotation and external rotation. So that is as far as I can go. So think of things in my daily living. Can you guys think of anything that's difficult with bad shoulders?
Taking stuff out of the cupboard.
Mm-hmm. What?
Getting something out of the cupboard.
Right. Getting dressed. With my shoulder this bad, this is my uniform. Because these are those Nike pants. I can pull them on. See, my hands are so weak and it's very difficult to hold pants with zippers up. I have to have belt loops to put my thumbs in to pull them up, right? So this, I just put my hands in my pants and pull out and just pull them straight up, because I can't grab the pants at all. So, and this is wonderful, these t-shirts, which I get 10 at a time, because I can step into them, because I cannot put anything over my head. See? And so you don't realize how many million times a day. So when you look at some of these things that I have, there's reasons for them. Not only is this, thank you so much. What was your name? Peter. Thank you, Peter. When you think about combing my hair or using hands to pull my bra strap up, here's another one. I use these things for everything. I have a washer and dryer, and my dryer is a top loader. Now, have you ever heard of a top loader dryer? It's magnificent, because you don't have to bend down and then try to reach in. So I can open the lid and then use this little hook and hook my clothes out. So is that cool? I mean, anything I can do myself is a boon to mankind. I love it. Like these scissors. I can open almost everything with these scissors, even nail polish. Can you see this little hole? All these openers will not open nail polish because the lids are not exactly the same. But these are wonderful. You can get them at Payless. I saw them years ago. I have all the good grips things at home because, see, I can't squeeze something small. I have to have fatter handles. So it works. Then I can do my own cheese. I mean, I used to put these on lamps, but when I'd go to hotels, but then I couldn't get them off. You know those little tiny things on a lamp that you have to turn the lamp on and off? Well, I can't do that because I can't pinch. So these work great, except I'd have to leave them there. So now what do I use? Is my pliers. These little pliers. I can turn all those lamps. So are those cool? So there's many, many things that I can do. My gosh, my father-in-law had a stroke. Magnificent. Fork, knife. Loved it because he could grab it and eat like a man and not be a baby. He loved these. Absolutely, they're wonderful. If I wear pants with a zipper, well, let's pretend that the lid is off. If I wear pants with a zipper, I have to take a pen with me to pull the zipper up because I can't pinch a zipper. See? And I was in a restaurant once in the bathroom and forgot my purse. I always have a purse because I have to carry my paraphernalia, right? And so I said to the lady in the next stall, could you pass me a pen so I can pull my pants up? And she laughed. But I thought, I couldn't get them up. What do you do if you can't do it? This macular degeneration. I was on OPB a few years ago with one of the rheumatologists, and we were talking, and the manager is blind. And she says, Jan, I hated being blind my whole life, but I'd rather be blind than have arthritis. She said, that's not fun at all. And I said, well, it's just the way it is. Well, now I'm losing my vision. And so I'm thinking, I should call her up and say, okay, now I have arthritis and I'm losing my vision, and now what are we going to do? Well, it's so funny. My mom, God rest her soul, she passed away 6 weeks before my daughter. She was 91 and a half. And I went in, she lived at an assisted living just about a quarter of a mile from my house. So I went in to see her one day, and she's in the dining room, and the light is coming in kind of like this, and I looked at her eyebrows, and they were shiny. And I'm going, why are her eyebrows shiny? So anyway, she was done eating, so I wheeled her upstairs. She was in a wheelchair at the time. And I said, Mom, why are your eyebrows shiny? I said, you've got lipstick on your eyebrows. She says, well, isn't that the best idea in the world? It goes on so much easier than eyebrow pencil. And I cracked up and she cracked up and her caregiver cracked up, I tell you. And so the nurse there, she just told everybody that story because it's humor. You got to keep humor, fellas and girls. It's just part of it. You can laugh with your patients, you can cry with your patients, but you are doing everything I always wanted to do my whole life. When I used to play covered wagon when I was with my cousins, I don't know if you guys played covered wagon, but we did. I was the nurse. I don't think they had nurses in covered wagon days, but I was always the nurse. I was always bandaging someone's leg or arm or whatever. So you have a wonderful profession ahead of you. You're going to be so delighted that it's not funny, and you're going to see a little bit of everything. My little nephew right now has leukemia. He's 2. He has the same leukemia my daughter had. It's my niece's baby. He's 2 years old over at Dornbecker. His nurses, I'm telling you, are angels. They are the sweetest people I ever saw in my life. Like I said, the doctors split in. They're so busy, they make their rounds, but the nurses are the ones. They comfort him, and his heart rate is down to 50, and His throat is filled with sores and his esophagus, and they're wonderful. They are angels, and that's exactly what you will be. Whether you work in a doctor's clinic in Coos Bay, Oregon, whether you work in a hospital, I don't care what setting you work in. It's that wonderful smile when you walk in the door that makes people feel better. I am not kidding, really feel better. When I had my surgery, when this right ankle surgery, well, I can't have a bowel movement in a bedpan. I mean, maybe you guys can, and I think all you nurses need to sit on a bedpan and try it, because I can't. Okay, so I told my nurse, I said, I can't do this. I'm never going to go. I'll just not go. If I'm here a week, I won't go. So anyway, she says, well, let me see if I can get an order for a porta potty thing. So it's like, okay, we're going to get the porta potty thing. Well, I couldn't touch my right foot to the ground. Do you understand? 0 for 3 months. So then you're dealing with a fused left foot that can't really, it can't move a lot, right? So I'm going, how are we going to do this? So this nurse took my elbow with her opposite elbow and got me in that porta potty. And I'm telling you, we could do it so slick, you wouldn't believe it. Everybody was amazed that it worked like a champ, but she's the one that thought of it. So see, then I had a place to go to the bathroom. And it made my whole day. It doesn't sound significant to you guys right now, but if you're in a position where you need one, you will love it. So you are the people that will think of those kind of things. You can ask patients about their activities of daily living. Are you having problem taking your pills? What are you having problems getting dressed? Is it, can you open and shut your car door? Whatever. Do you have someone that you live with? Do you live by yourself? How do people do it alone? It's hard. It's very hard. And you can be very young with arthritis. Like I said, my dad was 55. Total healthy Finnish man who, Finns are stubborn, and I'm half Swedish and half Finnish, so stubborn, right? So there was arthritis on both sides of the family, but it didn't stop him from doing what he wanted to do. And the nursing staff of his rheumatologist, my rheumatologist, my infusion nurse, there's 2 of them. One of them, 10 years ago, had twins, and she had a double mastectomy. Okay? Which to me is twins. Come on, 2-year-old twins and a double mastectomy, that's amazing. Now she has MS. Come on, God, that's too heavy. But that girl, I can hardly wait to go to my infusion every 8 weeks to see her cute face, smile at me. Everybody loves her because she's so genuine, but she's so efficient. She is so efficient that I love it. I love her. I can't say she makes what she does light, but she makes it light for me. I can't explain it. It's very hard. But she's got that attitude, and she talks and visits and smiles and asks you questions about your family. And and another thing. A year ago, her dad and mom lived alone. They were retired. Her dad had been working in the yard, came in, sat down next to her mother, and passed away. Her mother had beginnings Alzheimer's. She's now taking care of her mother. So I'm talking about come on now. So when sometimes you have to have times where you're so tired of being a student. You have to. Sometimes it boggles your mind. My brain can't comprehend. I can't read anything else. I can't retain anything else. Yes, you can. Yes, you can. Let me tell you, yes, you can. Do you have any questions? I'd like to have you guys come up and look at my foot. So whoever wants to do the range of motion on me to make a comparison, you're very welcome to come and do it.
I was curious if
Well, I like the scissors. I just happened to run across the scissors. I mean, that was just pure luck. You know what I mean? You have to excuse me. I have to have a mint. My mouth gets really dry. But these are mine. Well, I was going to hear something funny. That father-in-law of mine that's so cute, these are his. These sticks. I mean, these, one is a back scratcher, and one was a help put his shoes on. And I had my husband rivet my hairbrush to them. Is that a great idea? Yeah, I think so too. I mean, it works. And it's really funny because I have spoken at assisted livings, and I said to them, why don't you get a yardstick or just a stick, you can get them at Fred Meyer's, and put a galvanized nail or a hook at the end and have them pull their clothes out. Do you know how hard it is for someone 90 to pull their clothes out of the dryer? Well, we never thought about it. So they all wanted to buy my stuff, which I can't sell because, you know, but I mean, a lot of places don't think of things like that. And those people want to be independent. And I'll tell you, like I said, when you're 12, your hormone twists and you all of a sudden have a sexuality. Well, you have it when you're 90 because my mother was in an assisted living. There were 7 men and the rest women. One man named James, the last guy that moved in, is one of those kind of guys that would walk up to a patient and go, hi, Hazel, and pat her a couple times, or hi, whoever. Minute he got off the elevator, every woman in that dining room sat up straighter, let me tell you, fluffed their hair, put a smile on their face to smile at James because they wanted his attention. Now we're talking, these ladies are 88, 90, 92. It's that hormone thing, kids. Come on up and I'll let you see my toes. I don't fall off this thing. Okay. It's this fusion, this fusion are those 2 pictures. So you can wiggle my toes on this, on my right foot. My MTPs are completely gone. So whoever wants to wiggle them, wiggle them. Yeah, wiggle them all of them. None of them are connected. Aren't those weird? And it's funny because the surgeon said to me, and I thought that was ironic, he said, well, you're probably not going to like this because you can't get your pantyhose on. I thought, you idiot, excuse me, but I have no pain. What do I care about pantyhose? And I could get my pantyhose on. Isn't that funny? Don't you think that is? Yes. Uh-huh. Okay, now I have a claw toe on this left side. I want you to look at my claw toe. Okay, a claw toe is a flexion contracture of the PIP and a flexion contracture of the DIP. Can you see it? You can feel it. The second toe. Yeah, that's claw toe.
Like contraction.
Mm-hmm. Isn't that funny?
What does that mean exactly? So the
It's a hyperextension at the MTP, and it's a flexion contraction, meaning it's going down and down. Where a hyperextension would be, and a hammer toe would be a flexion contraction of the PIP and a hyperextension of the DIP. So it kind of goes up at the end. Doesn't that feel funny? Now I'd like you all to feel my shoulders. When you palpate, like I said, you always start at a neutral zone, and I want you to feel my shoulders and start at a neutral zone. Always use the back of your hands, okay? And you're going to feel warmth as you get up toward my shoulders. So whoever wants to start. You guys can do this way. Huh? Difference, isn't it? Isn't that amazing? And the back of your hand is more sensitive than your fingertips. And the right amount of pressure and palpation is to blanch your nails. Now I wear nail polish, so blanch the skin around your nails. Feel it, can't you? So that means a certain amount of inflammation is present. So I don't push the envelope when it comes to my shoulders. I'm a good girl. Let me tell. But I planted a garden this year. I have 3 raised beds that are 2 feet high, and they're 4 foot by 8 foot each. And I planted about 8 tomato plants, beans, peppers, zucchini, everything. Yeah, I had a great garden. I still do. Has everyone done all the field? Do you want to do my range of motion and try it?
Sure.
Okay. And right here. Okay. And bring it up to my point of resistance. Okay, that's limited my flexion, extension, and internal rotation and external rotation. That's it. So, and you can do it too if you want to. Anybody.
Do you have that heat anywhere else on your body, or is it?
No, actually, I don't right now. Now, before they fused my ankle, that ankle was burning hot all the time. So remember, the elbow to 90 degrees, and just go a little bit. I know my wrists are kind of funny. But I want you to palpate my wrist, you guys.
So we're doing the extension.
An internal rotation and external rotation. Okay, look at my wrist. This is a prosthesis. So I don't have a radial styloid or an ulnar styloid. And when you palpate it, it was a flange that they put in, and Dr. Thayer moved to Bend, and I guess he absconded with my x-rays. So I don't know what it looks like, but they said it would last 5 years, and it's been quite a few years. But I lost my grip. Can I have 2 fingers on each hand? Okay, and I'm going to show you how strong this hand is. Look how weak this one is. 2, see what a difference? So if I have this left wrist straightened and make it look beautiful, I'm going to lose. I'm not losing strength for any beauty. Let me tell you. No, 2 fingers, please, and I'll show you. Okay? Do you want to do it? Big difference, right? This one I literally have no strength to do anything other than determination. You know what I mean? Like if I'm going to grab something, I have to grab a lot of it. Like if I was going to grab her sweater, I'd have to have a lot. And also, make a fist. Sometimes that fist looks great from the top. Turn that fist over and it's like, whoa, there is no fist. You know. And so that kind of tells you how they're able to take care of themselves. Take the caps off their pill bottles. You know, just like some of these pharmacists. You know, they say, well, we have a talk with the pharmacist. We were teaching the pharmacy students from Oregon State, and I said, you people don't understand. When it says take with water, I went to 3 assisted livings in Salt Lake City, and I said, I want to know what you think is with water. Not one person said a glass of water. They said, well, a sip of water. They didn't tell me how much. And I said, why is it that there isn't a big block letters in every pharmacy in America that says when something's with water, you have to have a coffee mug size of water? People don't understand that people leave there with no knowledge at all that you need to have that water. I mean, so put it up there in block letters. My husband has never read the information that he gets with his medicine. He only takes 1 medicine, which is good. But he never reads anything, not anything. And I'm thinking, lots of people don't. Lots of people don't. So have it in block letters. Like I said, you need water with this medicine. And how much? Because it means, with water means that, okay, another thing, I have probably had more half cheese sandwiches than anyone on earth. Because when I took my aspirin, I had to have a half a sandwich every single time before I took my pills. So a half a cheese sandwich became my guru. I mean, because I took the medications at the same times, so I didn't wait till after dinner or after whatever, but I had my half a cheese sandwich. So I asked the people, and we had 15 of them sitting around a table, and I said, when they say that they want you to take your medicine with food, what do you take? Oh, a couple crackers. Oh, really? Yeah, well, a couple crackers. Whatever's handy. They had no clue that they should have a certain amount of food. A meal. My girlfriend's daughter just went to the doctor, and he said, I want a meal. Then you take this medicine. I want a meal. I mean, he said that to her. And I'm thinking, why don't pharmacists have it in block letter like this, put it up, big letters, with food means half a cheese sandwich. I mean, something that you can visualize and you can say, oh, this was equal to a half a cheese. Do you see what I'm saying? If you make it visual for people, then they'll do it. If it's written down, it's like, I don't know.
Or I've heard somebody say, well, I still feel full, but it's like 2 hours after meal, so I
Yeah.
think it's okay to take my
Yeah.
ibuprofen. It's like,
No,
oh, it's not.
no, not at all.
That food has gone someplace else.
Yeah, exactly. I mean, but they don't have a clue. They don't have any idea. So I still don't understand. I don't understand why these things have not been addressed all over the country. Because it's not just in Portland, Oregon. It's all, I mean, it's in Appalachia, it's in Florida, it's in California, you name it. And I was in Salt Lake City with these care facilities. I mean, so it's information world, give us information. So you as nurses will have that ability to ask those questions. Do you know how much is water, how much water you should drink? I mean, and some people can't comprehend a cup. If you look at a measuring cup, it's really small. 8 ounces of water is really small, right? But if you say, well, fill up a coffee mug, you know it's more than 8 ounces, but at least if they get something down, it's better than nothing. But it'll give them a visual of, this is what I can use. Do you see what I'm saying? Can you think of anything else?
So if you back in the days, in my young days as a nurse, when do you notice an improvement in control of your symptoms with the newer medications compared to when you were taking?
Oh, you mean me, with me? Oh, absolutely.
Yeah.
Much better now.
Yeah.
I mean, I have no pain. I mean, to me, it seems kind of ironic, but I don't. I have a problem with C1 and 2. In fact, the neurologist was thinking of fusing me a few years ago, and he says, well, let's just wait, see how it does. And I've done really, really well. That is the only joint those are the only joints that you don't, medical profession doesn't touch. You do your range of motion yourself. We could do that now. Do you want to try it, all of you? Okay, let's do flexion. That's chin to your chest. That's 40 to 45 degrees. Extension is looking at the ceiling. That's 50 to 60 degrees. Okay, rotation now. You should be able to put your chin parallel to your shoulder. Now you can see my limitation and see my limitation. And then that's 60 to 80 degrees. And lateral bending is 45 degrees and 45 degrees. So think of, with my cervical spine, things that are difficult.
So is that resistance due to discomfort, or you physically can't?
I physically can't. And if I tried to any further, I would have pain. Okay? Think of things like reading a book. I read a book. Like when I read a book, I put a pillow in my lap and bring the book up to me instead of holding the book or trying to bend my head way down. And when I'm in the car, I use all my mirrors besides turning, because I think it's safe. I was thinking the other day of what I could tell you students that would give you an idea what it's like. And when you have a flare-up with arthritis, everything can hurt. So think about tomorrow morning. I don't know if you set your alarm for 6 o'clock or whatever you do. Let's just pretend it's 6 o'clock. And you're in bed and the alarm rings, and I want the alarm in your bathroom, not above your head. So that means you've got to get up to turn it off. So when you get up out of bed, okay, your weight-bearing joints that hurt will really hurt. So getting out of bed, you're going to stand up. Now remember, your ankles hurt, your knees hurt, and your hips hurt, and you haven't even walked yet. I mean, you're just standing there. So you'll stand there trying to adjust to that pain, and then you walk to your bathroom. Okay, you turn your alarm off, right? And then you go to the bathroom. Someone forgot to put the toilet paper on, the roller. Well, if your hand's really sore, popping that roller off the little thing is a killer, right? So, yeah, I don't know if you're going to do it then or you'll wait till after you take your meds, but you need to go to the bathroom. Then you're going to brush your teeth. Well, just holding a toothbrush. Electric toothbrushes are nirvana for patients with arthritis. Let me tell you, they do all the work. And they're big and fat for me to hold, and I love my electric toothbrush. But if someone cranks, my husband puts the toothpaste cap on too tight, I can't get it off, so I use my teeth, except I have popped my my crowns off with taking things off with my teeth. So I promised my dentist I will never do that again. And that's a lie because I know I will do it again. Do you know what I mean? Okay, so then you're going to get dressed. So you really haven't done anything all day. I mean, not dressed. Say you're going to get your robe on and go to the kitchen and whatever you're going to do, make breakfast or whatever you're going to do. So when you think of these things that you take so for granted that things are hurting all along the way, it's really hard and it can be very demoralizing. So if you act like a challenge, it is a challenge, then it's not demoralizing. So do you understand? It's, and I think I've done that all along. Just like we have a split level house on one side. So my husband's TV room is up there because he watches sports and I hate sports. I mean, I don't mind sports, but 27 hours a day, I can't take it. So anyway, he has a TV room and our bedroom's up there in a bathroom. So I come down 6 stairs. Well, everybody says, Mom, you got to sell the house. You've got to sell the house. You got to sell the house. It's time. Well, I am doing fine. I have gone up and down those stairs with braces, casts, you name it. I mean, whatever it takes for me to keep going, I just keep going. I go in my backyard and I plant my whatevers, and I may be a little sore if I plant because when I plant something, I usually do the whole garden in one day. And then I rest the next day. And like I said, I have a rest every afternoon. I lie down on my couch, look at my flowers, except my flowers are really not doing well at this point because it's the end of the year. And I go to sleep. And it rests me and I can be revived for the next time. So any encouragement that you can give is wonderful. And any time that you could say, maybe having a PT or an OT visit is great. No one suggested anything in the beginning. I didn't have a brochure. I had nothing. Do you understand? They sent me home and I'm in bed and I'm sitting there. I can't do this. I can't do this. I'll lose my mind. I mean, like I said, I want it done my way yesterday. And how am I going to do this? And you know, you talk to God a lot, like, okay, I can do this. I'll read. Boy, did I read. I read and read and read. And you know what's funny? I rested and rested. And when they put me in the hospital, a lady was in the next bed with the exact same symptoms as mine. And they told her that she had to go to bed, and she told them no. I saw her 10 months later at my doctor's office in a wheelchair. She couldn't walk at all. Now, we know now, in 2012, you move it or you lose it. But in those days, they didn't know what to do with me. They absolutely didn't have a clue. Like I said, when they said, get out of bed, it was like, okay, get up. And I'm going, just like that? Yeah, get up, drive your car, go to the store, take the kids here. And it was like, oh my God. It's a whole different brain set than being down for 10 months. So, I mean, is there anything else I could tell you guys? Anything that would help?
So you're going to have to do something with the rubber bands.
Oh, yeah. Did you get your rubber bands? Yeah. Oh, I want you to see my nodule.
They're not causing the proper.
It's just fibrous tissue?
Yes.
You said it moves with your...
Yeah, and it just moves. You can move it. And I had one removed from my right ear, and he removed 1/5 of my ear. And when he didn't tell me until after he was done. Oh, by the way, I removed 1/5 of your ear, and I'm thinking, oh, great. Now what am I going to look like? I mean,
Now your son's really going to be...
yeah, he was so embarrassed by the bandage, I thought he was going to have a heart attack. Oh, my good grief. Isn't that funny? Now, the surgeon removed these nodules 2 times. I used to be a bookkeeper, and when I was doing bookkeeping, I was leaning on a desk, and they would leak. And he was really concerned about infection. Yeah, so we removed them twice, but when I started methotrexate, I got it back. Isn't that funny? Okay, what was it? Oh, our rubber bands. Okay, I want to get a pen because I want you to feel what that feels like to write. Let's see here. Okay, I want to show you that I can write. How's that? Well, look at my printing. I mean, but I write different. Okay, let's put something on the back. Oh, okay. I'll write my name. There. So I can write. I just kind of do it sideways. I send 60 Christmas cards with notes.
Actually more legible than mine.
Okay, so now I want you to try to write with your rubber bands.
It's tight.
Yeah, you can do it though.
Yeah.
See?
It's not too, I mean,
No.
it just is uncomfortable.
Yeah, it's very uncomfortable. It's very cumbersome, and it's hard to do. It's hard to grab. Like I said, to slice a tomato, you have to hang on to a tomato to slice it. How's that feel?
Feels kind of
Doesn't that feel funny?
Like a figure eight.
Yeah. Did you? Here. Did you want to make a copy of this musculoskeletal exam? Just for the heck of it?
Okay.
Oh, and I want to show you this picture in the back. One of the gals is a graphic artist. Let's see here. And she made this with all the findings on it. Is that cute?
Oh, wow.
Yeah, I think your students
So
get...
this would be typical of a person with
Yes.
arthritis?
Yeah, and it tells all about all the findings.
Oh, wow.
Okay, so if you just maybe want that, just that. Okay. So think of everything you do in your daily living. So now you're going to try to pick up your pills, drop the pills. How about change? You're in the store and you drop the change and you're going, oh, now I have to pick this change up. You know what I mean? So it's, like I said, it takes patience. You just learn this wonderful thing about patience, that because you don't have a choice. You know what I mean? I can't do it differently. It's the way it is. And don't forget to put your beans in your shoe at some point today and walk around. Because let me tell you, that when I first started having that pain, it was minimal. I thought, well, this isn't so bad. And I would pat it. Well, you forget that you're going to get in the shower and the tile in the shower is like a rock. So I used to take 2 bath towels and fold them and fold them and fold them and put them on the bottom and get them soaking wet, because that's the only way I could take a shower, because I could not stand the pain of standing on bare tile with my bare feet. Oh, the pain was horrible. Yeah, it was really, really horrible. I thought it's been a magnificent surgery. Now they fuse your big toe. Well, just think, if they fuse your big toe, what you can't walk. So why would they? I know so many people that have had their MTPs removed and fused their big toe. Why? Now they can't walk without shoes to get out of bed. You have to have shoes on because it won't bend. Well, is that silly? Why don't they do this to everyone? It worked. I mean, I just can't imagine why creating something. And see, it looks like a hallux valgus. It's not real. They put a pin in that toe, my big toe, my great toe. And it stayed really straight for about 15 years. And then, as the other toes kind of weakened, it kind of moved over. But it's still wonderful. I have no pain with it whatsoever. See? I mean, it looks like feet, right? Even if the big toe is an odd shape. And I suppose I could have it straightened, but why? You don't care. and I don't care. So who would I straighten it
Who are you
for?
straightening it for then?
Yeah, exactly. So why put myself through it?
Right.
Don't you think?
Exactly.
Yeah. So are you all excited? I'll bet you are too. What kind of nursing do you want to go in? Does anyone have an idea at all? You don't know yet? Oh, really? Yeah, that's great. I'll tell you, the nurses up at OHSU, my daughter was on K-14, off and on for 14 months, and oh my God, are they just angels. I just have to tell you, they're just totally angels. They're just the nicest, most efficient rays of sunshine. Like I said, the doctors, team of doctors swing in, stay there 10 minutes, and they're gone. But it's the nurses that keep the morale up, the this up, the everything. And open the blinds and not have it be a dungeon. And I mean, it's amazing. It's just amazing how cheerful they can make a horrendous situation. I mean, every single day, it was, they were magnificent, absolutely. And like I said, my niece's baby, his little nurses are wonderful, wonderful. And he was in the PIC unit, you know, the pediatric intensive care, for about 3 days. And my little niece told me she was the only mother there. No other mothers came to see their babies. The whole 2 days she was there. She was the only mother. So the nurses have to hold the babies and rock them because there's no one there. And I'm going, why not? I mean, where are the parents? How about Aunt Hilda or someone? I mean, no one? I couldn't believe it. She said she was flabbergasted, absolutely flabbergasted. She was and she had to stay there because he had C. diff, you know, that diarrhea. And so she was isolated with him, and so she couldn't leave, and not a soul. She was the only mother, which was just incredible. And she said those nurses are just amazing. And taking care of preemies and those sick little 2-year-olds, oh my gosh, it's amazing. So anyway, can you think of anything else you'd like to hear?
So the pain in your ankles was from the bending? I mean,
Oh, yeah. I'll tell you what, usually everything with arthritis is bilateral. So if your left ankle hurts, eventually your right one will. My right one didn't hurt for years. But I decided I was going to start walking a mile. Dumb. I think the Lord wants some people to exercise and some people just go home and vacuum. Anyway, I started walking a mile. And all of a sudden, my foot started to swell. And it was like, gosh, that feels odd. I'd never had a pain in my right ankle, ever. Okay, so I walked and walked and walked, and the pain got worse, and the swelling got worse. And I went, my rheumatologist said, well, maybe you shouldn't have walked. And I stopped walking, obviously, and then I was in the brace, that black brace. And I wore that for over 3 years, and then we had the surgery. But everything is bilateral, which is true, it is. Now I want you to look at my fingers and see how subluxed my finger, look at my thumbs. Subluxation, you know, the bones meet end on end. If they move over due to synovitis causing the ligaments and the tendons to weaken, that's called subluxation. Then, of course, if they are not meeting end to end at all, then that's dislocation. So you can feel my subluxed thumbs. And then I want you to feel my fingers, because if you feel the MCPs, I want you to go just distal to them, and you can feel how malaligned every one of them is. So if you use your thumb, turn this way, and you're going to use your thumb. What you're going to do is go on the joint, and then you're going to go just distal to, and you're going to feel how subluxed all mine are. Okay? Somebody else want to try it? So they're all malaligned.
oh yeah.
So you can see how short my fingers are. And it's almost like they're completely fused. Mm-hmm.
Wow. Thank you.
Mm-hmm. And you know, some people are bothered by my hands, and I think, well, I can't understand why. They're just hands. They just look different, but they're hands. And you know what's funny? Children are amazing. They'll look at my hand and go, what happened to your hand? You know, and then I tell them some story. And, but kids notice things, and it's so cute. I love it. Mm-hmm. Well, you know, the first thing you say is, do you have a flare, and which one of your joints are particularly flared? Because you know how you get up on the exam table, you know, there's a little shelf there, and it's like, I mean, that is, with a flare, depending on where the flare is, that's a physical impossibility. So sometimes just you can have them just sit in the chair and do a lot of the exam from the chair. But you need to ask them, and people need to tell the nurses that this hurts me. Don't leave it to, oh, you touched me, and you know that. Because Mary, the friend of mine that was a transplant nurse that has psoriatic arthritis, you can't see anything. She has no findings. Her hands are gorgeous, but if you grabbed her, she would yell in your face, but you wouldn't know that there's anything wrong or anything that she was in pain by just looking at her, see? So you need to ask, I mean, is this bothering you? Or say you're going to give a shot, you know, and you're going to help someone take their jacket off or whatever. Before they take the jacket off anything, ask, is this shoulder sore today? What is, because they may have come in for a cold and not even mentioned anything about their arthritis. You see what I'm saying? But you're going to give them a, I don't know, flu shot or whatever it is. And so if you help them off with their coat and you don't realize that, ooh, this lady or man's got really bad shoulders. And so, so you have to address that before you do anything. Because there's no way for you to know, like with Mary. There would be virtually no way to know with her. Okay?
So you just give the flu shot in a different way, or?
Well, no, you just hold the arm maybe differently or whatever. I mean, like I said, if you're going to give a flu shot, say to an elderly like me, I'm 73, but I mean really elderly, that doesn't give a lot of information, and maybe you can see she's struggling with her jacket. You can say to her, here, let me help you with that, and is your shoulder bothering you today? Because maybe it'd be better to give it to her the other arm. Maybe this arm hurts, but this one's pretty good. You see what I'm saying? But you've got to verbalize, because you have the ability as a nurse, you've got that time, where the doctor's not going to. He won't have time. I mean, it's just not going to happen, not in this day and age. So I think that's, like I said, that smile on your face and what can I do to help you? And I think I broke my finger is one thing, but then I need to take some x-rays. You have to take my jacket off. Is your shoulder okay? Can I help you? Can we help you get dressed or undressed for the, whatever. Just ask questions. I think people appreciate if you ask questions because you cannot read their mind. It's impossible. Totally impossible. Okay? How are we doing? I'm fine. Yeah, I'm fine.
No pain, right?
Huh? No pain. Is this great? This is Nirvana, I'm telling you. I should advertise it, don't you think? I love that golfer. What's his name? Phil Mickelson, that's advertising Emerald. I mean, can you imagine, and he is still playing golf? God bless his soul. That is great. I mean, that's how good that medicine is. Oh, well, I'll tell you something, a little story. Mary, when we started our program at OHSU, Mary was going to a doctor, a rheumatologist, a woman rheumatologist, and she was ready to kill herself. Mary's a transplant nurse. She was about 38 years old. She was in bed 20 hours a day. She probably awake maybe 4 hours. The pain was killing her. She had no life whatsoever. She was not married. She had no children. Her doctor said to her, Mary, every time you come in here, that's all you are is complain about pain. I've given you everything I can. And Mary said, I have arthritis. That's what arthritis is. It's about pain. Anyway, so the doctor left the room and the nurse came back. She had overheard it. She says, Mary, I want you to go to OHSU to a doctor. I just want you to have an evaluation. Just go. Because she knew Mary was depressed. Really, really depressed. She said, you don't have to stay, nothing. Just go for an hour for an evaluation. She went up, and he happened to be the director of our teaching program. She walked in his door and said, listen, I'm this old. I have 4 hours a day where I feel like I'm alive. I don't care if I live or not. If you can't help me, I'm out. I'm out of here. That man, in 1 hour, convinced her, Mary, you give me a chance. He took her off half the meds that she was on. Would you believe she was teaching medical students with us? She was swimming 3 days a week, and a year and a half later went to Europe to see her best friends in Germany for a month. That's that word hope, that nurse, because she overheard the doctor and knew Mary was depressed, saved her life. And she tells that story to all our students, everyone. I mean, she's not ashamed of it at all. Like she said, I had the pills, I had the wherewith, I didn't have to live. I couldn't live like that much longer. But he gave her hope, period. And it was, I mean, it was wonderful. Wonderful to see a totally different person emerge. Is that a great story or what? I mean, and it was her nurse that did it, that saw that in her and grabbed at that to give her a chance. And that word hope. That word hope is everywhere. It's got to be everywhere. I don't care what. I don't care what disease you have. I don't care if you don't have a disease. That word hope has to be in your vocabulary. It's true. Absolutely true. Because everybody, you have parents, probably brothers and sisters. You have a grandparent that's sick. You have something somewhere, aunt, something. And it's like, we can't control the universe. We cannot. But by God, we can give it hope. Period. Okay? Can you think of anything else, ladies and gentlemen? You've been great.